Thanks, Stephen. Well, September is Prostate Cancer Awareness Month. And this morning we are joined by urologist Dr. Eddie Bugg of Urology Centers of Alabama to talk about this very important issue. Good morning. Thanks for joining us.
Good morning. Thank you.
First of all, what are the symptoms of prostate cancer? So many people really don't even know what it is.
Right. Well, the problem with prostate cancer, as with a lot of cancers, you don't have symptoms. And that's really where the screenings come important, and that's really what we really try to focus on with our patients.
Right. Before we get to the screening process, what are the risk factors? I mean, is it a hereditary thing?
There are. Yeah, there's no question that prostate cancer tends to run in families, for certain families. The problem is we don't know with a lot of cancers. We think diet probably plays a role, environment probably plays a role, and again, certainly genetics.
And so screening is so important. How old should men be when they start getting screened?
Well, right now the current guidelines say start at age 50, and we found that early detection is better. So we start screening all of our men now at age 40, and the goal is early detection means cure for the cancer.
Absolutely. What are those treatment options that are available? Right now we're actually taking a look at some video of a procedure, but how is this treated?
Well, the treatment for prostate cancer has made a lot of advances through the years. The surgery techniques, the robotic surgery that you're seeing here certainly has made a lot of improvements. The radiation treatment is a lot better. And again, the message we really try to relay to our patients, if you can catch these cancers early, the treatment options are so good now that you can treat the cancer, you can cure it, and really maintain good quality of life.
Are you finding that with more awareness being raised that men are less hesitant to come in and get screened for this?
It's better. It is certainly better. We have a lot of men that are apprehensive in terms of what's involved with the screening, the exams, and then, of course, they look ahead and say, well, if I have cancer, my life is going to be over.
Right.
And that's certainly not the case. And that's where we really try to put the word out for early detection and screening. Screening
now more than ever, so important. Again, with all the advances in technology and science, I mean, there's so many available treatment options. So it's not that, you know, it's a death sentence as it used to be, especially with screening. Again, catching it early is so important.
That is correct.
How can people find out more information on this?
There are a lot of ways. You can go online, certainly talking to your medical doctor, your urologist, certainly welcome to call our office at any time. Again, the message we put out, start screening at age 40. Your PSA, 2.5 or less for our men that are in their age 40 to 50, and the exam. Is there a particular demographic that you find is having prostate cancer, maybe younger? Well, there's no question that African-American men tend to have a higher risk, but again, the key is all men are at risk. It is the #1 cancer in men across the board. It is still the #2 cancer-related death in men. So for all men, it's important. And that's really, again, early detection is the key. Dr. Eddie Bugg of Urology Centers of Alabama, get screened, no excuse. That's right. More information, go to CBS42.com. Thanks for joining us this morning. Stephen, over to you.